Drum will rely on local hospitals as it works through a staffing shortage. 7 News reporter Lexi Bruning explains what it means for moms-to-be.
Hundreds of babies are born at Samaritan Medical Center every year, almost half of them connected to Fort Drum.
In 2023, there were almost 1,400 births here at the Center for Women and Children, and 45% of them are actually military dependents.
Fort Drum's OBGYN clinic on Samaritan's campus is short-staffed. The plan, expectant mothers will be referred to Samaritan Medical Center and Carthage Area Hospital for their 3rd trimester. The clinic will continue care for those in their 1st and 2nd trimesters.
The Center for Women and Children and the wonderful staff here, the nurses and the assistant staffs, they've already cared for these patients in many ways, so that won't change.
With taking on some new patients, Samaritan is looking for additional support, which could mean adding physicians to on-call duties and increasing on-call hours.
Making sure that we have someone here to deliver these wonderful newborns at any time of the day.
Fort Drum assures patients these plans are temporary. Medical Department Activity, or MEDAC Commander Colonel Christina Buckner, tells 7 News in a statement, quote, "We are in constant conversation with both hospitals to ensure preparedness to execute the plan." Another example of a community rallying together to bring new life to the North Country.
Because Fort Drum brings that unique healthcare model, we all work together, all the local hospitals, all the providers, to make sure that we're caring for our military families.
Patients with questions or concerns are asked to reach out to MEDAC's patient advocate. Lexi Bruning, 7 News.